So, Kurt, it's up to you. It's time for a little breather.
We agreed there's no such thing as a dragon, right?
Yeah.
Because that looks pretty weird to me.
What just happened?
I extended my protective shield. You're lucky I still need you.
Hands up!
He's too big to fit through the opening, so I think we're safe.
Appears to be Lexington's way. Okay. What the hell just happened back there?
It was a hologram. It's like Raw wasn't real.
Are you saying we came all this way for nothing? We have to go back inside.
You must be joking.
The dragon is the final test.
It would be madness to challenge that thing.
I don't think we're gonna have a choice.
Anybody know where that clip comes from?
Okay.
Did you hear what Dallas said right at the beginning? We agreed that there's no such thing as dragon. And if you look on that list, those are, I think many people recognize many of the statements up there that are used in the healthcare debate. And the last thing that was said on the clip, we're gonna have to face that dragon anyway. For many people in America, they face that dragon alone, without help, without the resources, to be able to continue on with their lives and receive the health care that they need. They're facing it alone because we are divided, which means the interests involved in health care, maintaining the status quo, are united against anything that changes that. And they have the money to perpetuate the current system that we have. So healthcare as a basic human right is one point that most of the people that I've talked to agree that healthcare should be a human right. And I think I'm almost certain that would change the debate in the country, but that would require a constitutional amendment for healthcare as a human right. Because as soon as it's defined as a human right, America, as the defender of human rights around the world, will have to face this vexing issue. You can't be a defender of human rights around the world if you have human rights problems in your own country. Now, you got some cards on the table. So, I want you to take one card and I want you to write down, and this has been a while ago, write down where you were at and what you felt like when you heard about or saw 9/11 occurring. Just write down where you remember you were at when 9/11 occurred, what you felt like, and what your thoughts were. And then maybe I'll just ask this question. How many have seen at least one of those statements on the screen? 2, 3, 4, 5, 6, 7, 8, 9. How many have seen all of those statements that are on the screen? Okay, do you realize some of those statements started 60, 70 years ago? That some of those statements started in the late 50s. Some of those arguments on the healthcare debate started in the late 50s. I'm not quite sure how to do this card thing. This was a last minute thing. How many of you, how should I ask that? Is there a difference between your feelings on American healthcare and what you felt like at 9/11? Is there any difference in the depth of those feelings? So I must have been talking about it too much. Go ahead.
I have, I do the healthcare thing, but, for whatever reason, and I know that I just got mercy and got grace, when I first got sober, I had no money, no anything, and, I had to jump through some hoops, but, I mean, I got all of my needs and wants, met for free, as far as my addiction medicine, my addiction doctors, the doctor gave me a house call to the treatment center for me. I know that that's not everybody's experience, and I know that all of those things are true. I'm not disputing that, but just my own personal thing. Like I said, it was a miracle that it happened. I know that it was. You know, nobody else has this story, but it just took a lot of hoops to jump through in order to make that happen.
Yeah, well, that reminds me to bring up something too, is that I've been talking about the negative side, and there is a lot of positive in the healthcare. You have a lot of dedicated professionals that are working in this field, doing the best job that they can. However, some of them, like, for instance, in a family doctor, a few years ago, the normal panel of patients that they would see would be 1,500 patients on the panel. Now it's pushing 2,500 to 3,000. There's something known as a 23-second goal. I read this in another paper, that when you walk in and talk to your family doctor, the average time that you have to tell your story before your physician interrupts you is 23 seconds. So you'd better be good and quick at telling your story, because they literally don't have the time that they need to take with each individual patient. And that's a system problem. So when I'm criticizing healthcare here, I'm not criticizing the people. And I gotta make that very clear, because I haven't at some points in time. And it's got me in some trouble. But it's about the system and systems that we have in this country. One of the things I thought about on difference between 9/11 and healthcare is the fact that 9/11 basically happened to all of us. It happened to us as a community, as a nation. It couldn't help but touch you. Healthcare doesn't. Go ahead, Drew.
Well, it reminds me of the statement was a pastor, I think it was Niemöller, that during the Holocaust, he said, first it came from the Jews, but I wasn't a Jew, so I didn't say anything. Then it came from the blacks. That it isn't hitting everybody right away first, but it's working its way there. As long as it's not hitting me, I don't really care.
I just want to say I had a very good experience, but partly was because of my age and the insurance. At that time, 9/11, I was at home recuperating from major cancer surgery, and I was at the University of Wisconsin Hospital. And because of my age, 71 at that time, and my Medicare and AARP, the other insurance was very good. And in spite of I don't even know how much the bill would have been. It would have been over $10,000, I know. At least. And I didn't have to pay 1 cent.
Right. See, one of the problems, until we as Americans can drink from the same cup of healthcare, whether it be everybody is diminished to the lowest level that people are served by healthcare in the country, it's not going to sit there and change isn't going to occur, because you've got the divide and conquer mentality. I have mine, and sometimes there's a little bit of fear there because, well, if somebody else gets some, maybe I'll have something taken away from me. And I'm going to have to close it off today because I'm running out of time. And we're going to be doing this for a couple of weeks. I didn't bring all of this up with me today to cover it all today.